It appears that this expanded investigation is focused on how UnitedHealth Group is paying their physicians, their affiliated and employed physicians. Remember, they have about 90,000 of them, probably most of them affiliated, not employed. And this is something you and I've wondered about, right, for years, where you can look at the state level filings and see these transfers, intercompany relationships and intercompany transfers from the insurance company to Optum Health, where the docs are affiliated or employed. And one of the tricks of the trade has been, since the passage of the Affordable Care Act, something called MLR burn, where you overpay or you somehow overpay for benefits in order to get your medical cost ratio to a point where you don't have to send money back to the federal government in the form of rebates. If this is part of the investigation, I would not be surprised. We are just speculating now, but it always struck me as a way of defrauding the premium payers, the members, or the federal government, because you're artificially elevating your benefit costs when they are when that's not the case. So the second area of focus seems to be around the pharmacy benefit manager. And I mean, if you told somebody how pharmacy benefit managers that are, owned by insurance companies and the actions between the insurance company and the pharmacy benefit manager, a normal person would say that looks like a kickback. But in healthcare, no, it's okay. And so I suspect that there's also, something going on there with respect to formulary placement and all of the things that people have accused UnitedHealth Group of for many, many years. The point of this is that if this expanded investigation, if it's accurately represented at this point, and it is successful, then what it's doing is kind of threatening UnitedHealth Group's business model in the long run. These things take many, many years to unfold. So, but it's taking aim at kind of what they were trying to do, which is become this, insurer and healthcare provider, and one, an empire they've built up for quite some time. So it's I continue to be kind of negative on just the way in which they're approaching the business. That doesn't mean their stock price won't perform and they won't make money, but on the long run, I think they've got just a threat to the way in which the business is consulted, and that ultimately is going to have to change the model a little bit. So
let me ask you a couple questions on that. So the Biden administration was very favorable generally to things like, Affordable Care Act enrollment periods,
right.
and sort of pulled a lot of levers to make it, very, I guess, an industry friendly, right? This is
Yeah, correct.
to me, this could be UNH specific, but who is on the other side of this within the Trump administration? Does this fit any of the mandates, and why does this stop with UNH? Why, if it seems like if these are specific patterns, that they're probably industry patterns, right? I don't really, I wouldn't, yeah,
I
fraud,
would,
fraud today was, was business usual and customary, 2 years ago in a lot of
right.
cases.
I would agree that it could affect the whole industry. I do think that there's some industry wide problems, and my long term thesis is that health insurance in America was broken by the Affordable Care Act, but just needs about 20 or 25 years to actually show up. The with respect to the Biden administration, yeah, absolutely. Part of the mission, for a lot of their rulemaking and a lot of their enforcement action was intended to, keep the legacy of the Affordable Care Act alive. Don't do anything that would would suggest that there's something gone wrong here. And that shows up in really many aspects of rulemaking, not just their sort of laissez-faire attitude towards the pharmacy benefit managers and so forth, which give Lena Khan credit for at least trying. They couldn't get anything over the line with that respect. So
But the
now
organizing principle here, if you looked at the largesse of the Biden administration, the organizing principle is let's kill the Affordable Care Act procedurally.
I don't know that kill is what they want to do.
Harm, remove, pull back.
How about this, becoming actively indifferent to its success? And when I say, actively, yeah, I mean, this is a law that it kind of it turns healthcare. I mean, healthcare is not health insurance, right? Those are two different things. And I was talking to somebody yesterday, and he was, complaining about the different incumbents. I said, yeah, but who are you happier with after a medical episode? Are you grateful for the good work of your doctor, or are you pleased with your insurance company for paying for it? Well, no, you think about your doctor.
Yeah.
So
Yeah.
so they're in this kind of artificial place of that I think is active indifference is probably the best way to describe it for the time being. And I've written about this a lot, Tom, and that is that Barack Obama, the former president, is taking a number of reputational hits. And as long as he keeps taking reputational hits, if this proceeds, then the need, not just within the Trump White House, but the need within Congress to preserve his legacy becomes a whole lot less interesting, and career damaging.
Yeah, sure. But I think the third rail really would be is you really start screwing with Medicare Advantage, and if you hurt seniors that way, it's a popular program. That if you go too far, if you cut too deep, that would be the political pushback potentially on something like this UNH regulation.
That's correct. That's correct. Yes.
Okay. All right. Thanks so much. That's super helpful.
Thanks for watching Hedgeye on YouTube. If you haven't already, make sure to click on the button below there. Subscribe to our YouTube page. You can also follow the link in the description to our website to get even more great investing content.